Okay, so today we're doing wound assessment. We begin by performing hand hygiene. Had I have a patient, I would make sure to address myself. Hello, my name is Sidlin. I'll be your student nurse today. Today we're going. Can I just get your full name and your date of birth? They would provide me this information. I would explain that we're going to do a wound assessment, and then for this assignment, we will do a sterile field. Prepare a sterile field. Prior to beginning this assessment, we'd make sure to draw the curtains for privacy and raise the bed to a working height. I would ask, do they have any pain, any sort of discomfort? Do they need to use the washroom? In this instance, they would say no. And now we begin our wound assessment. We begin by putting our gloves on. Making sure to grab our necessary measuring apparatuses. So, we begin by taking off the dressing and eliminating this in our waist. When we assess the wound, we're looking for any redness in the peri-wound area, as well as edema, ecchymosis, drainage, and approximation. As we can see, there is a slight redness around the peri-wound area. There doesn't appear to be any ecchymosis or edema buildup. In terms of drainage, there does seem to be a slight serous drainage around, but very little within the wound. And for approximation, as we can see, the edges of the wound are not close together, so we conclude that it is not very approximated. When we're looking at length, now we will measure with length, depth, and undermining. Length, width, depth, and undermining. So for length, we'll make sure to draw from each edge of the wound. So we can see that this is well above 10 centimeters. For width, making sure we're looking at 4 centimeters. And then when we measure depth, we're going from the middle, which would be the deepest part, right to the edge, which is again about 3 centimeters. And now for undermining, we make sure to take our Q-tip, put it in the center, and move in a circular fashion to see if there's any erosion around the inner tissues. And we can see that there is none, so we can conclude that there is no undermining. Now we'll toss our measuring apparatus in the bin, as well as doff our gloves appropriately. In preparation for a sterile field now, we'll don on gloves. And if we had Lysol wipes, we would make sure to wipe our table down, making sure there's nothing on the table. Wipe our table down prior to setting up our sterile field, and after wiping, we doff our gloves, so we no longer need to. We'll commit to some hand hygiene, and we'll get started with our sterile field. So we make sure that when we commit our sterile field, we are alongside the same side of the patient, making sure not to turn our back to our sterile field to compromise integrity, and making sure that we are still within reach of our patient, which in this case is the wound. So we begin by committing to a trash receptacle.
So now I'm going to get
5 minutes.
my stuff. I have 2 containers, one with the oral care solution, one with water. So I'm going to place 5 pipes in the oral care solution and 5 in the water. So I'm going to also make sure I have a towel readily available so that the patient's mouth is dry after. So I'm going to divide my patient's mouth into 4 quadrants. I'm going to begin
This tape does
my
not.
patient's mouth with 1 to 7
There it is.
So
Taping our trash receptacle to the side, making sure to keep it between our... There it is. Now we begin by unfolding forward, to the side, to the other side. On our last fold, we grab our forceps, knowing that it's sterile at the tip, clean at the bottom, and unfolding back. We want to orientate our sterile field so as to have overhang on the side so it doesn't touch our scrubs, compromising sterility. Noting that the 1-inch border on the sides of the sterile field are for clean, so it's okay to touch with our fingers. And when we put our forceps down, sterility stays within sterility. We adjust our tray.
Now we're going to get our water.
Good.
And we're going to begin the same method. We're going to do the same method.
Now we'll be adding our 4x4 gauze. So we make sure to peel away from sterility. And in this situation, we can, because it's sterile inside, we'll make sure to grab our forceps, being careful to remove, place within the bin. Eliminating this in our waste, as well as our 2x2 gauze. Making sure to grab with our forceps away from our sterile field. Eliminate with waste. Now we have to apply our sterile solution. We make sure to check it's not expired. It expires June 2025. Because it is open, we need to lip the bottle, i.e. emptying out a little bit so as to clean and ensure sterility. This is me emptying. And then we'll pour along the side. Prior to pouring, however, we want to ensure our tray is on the edge within the 1-inch border, so as to make sure any runoff does not interfere with sterility but comes off on the clean side. Making sure to palm at the label. We pour. Now to dress the wounds, we'll be taking our 4x4. Oh, I apologize. We'll be taking our 2x2, dipping it in the sterile solution, and making sure to clean the wound. Cleaning the edges, eliminating in our waste. As well, now we'll be using more metal forceps to take the 4x4s, and making sure to drape over the wound to pat dry. In this situation, we would also be applying a dressing. However, I don't have the tools, so I'll be leaving it there and committing to our sterile gloves now.
Raise the bed rail.
Making sure to leave some space.
I'm gonna raise the bed rail on the next side.
Moving our sterile gloves away from our field. Placing it down. Throwing this in the trash. Opening up our gloves, making sure not to interfere with sterility. Opening from the sides. Now we'll begin by grabbing from the inside. As this is clean, we're able to grab it with our fingers. Beginning with the dominant hand. Because we can touch on this side, we make sure to grab on the inside.
Time's up, guys. Stop videoing those people.